If you've ever wondered whether keto is a fat-burning miracle or a fast track to heart problems, today you'll finally get a straight answer. We're breaking down what to eat on keto, who actually benefits, real side effects doctors are seeing, how it impacts your heart, kidneys, liver, skin, and even cancer risk, and whether you should do it or not. By the end of this video, you'll know the exact beginner food list, how to start safely, what labs to monitor, red flags to watch out for, and smarter alternatives if keto isn't your match. This isn't a fanboy or hater talk. We're drawing on recent reviews and medical guidance, plus what large heart and diabetes organizations now say. I'll show you both the hype and the hard truths, so you can choose with confidence. Keto diet is a very low-carb, high-fat, moderate protein eating pattern designed to shift your metabolism into nutritional ketosis, where your liver makes ketones and your body uses fat and ketones for fuel instead of glucose. Most keto plans cap net carbs at 20 to 50 grams per day, which means you have to prioritize fats and keep protein moderate so you don't kick yourself out of ketosis. Keto diet started as a medical therapy for drug-resistant epilepsy, and that remains a proven long-standing use today. Its modern popularity exploded because it can suppress appetite and support short-term weight and glucose improvements for some people. With keto diet, you can eat freely and build your meals around these daily. Non-starchy vegetables, spinach, kale, lettuce, broccoli, cauliflower, cabbage, cucumbers, zucchini, peppers, mushrooms. Proteins like eggs, fish, and seafood, especially oily fish like salmon, mackerel, and sardine. Beef or lamb in moderate portions. Tofu or tempeh if doing keto vegetarian. Fats like extra virgin olive oil, avocado or avocado oil, olives, nuts like macadamia, pecans, walnuts, and almonds. Seeds like chia seed, flax and pumpkin, butter or ghee in moderation. Full-fat plain Greek yogurt and cheese if you tolerate dairy. Flavor and extras like herbs, spices, cocoa powder, coffee or tea, lemon or lime, vinegar, sugar-free electrolytes or broth. After taking notes of the things to eat in ketosis, here are the limit or things to avoid to stay in ketosis. Hence, you ruin the process. Grains and starches like rice, bread, pasta, oatmeal, corn, most tortillas and most cereals. Sugars and sweets like soda, juice, candy, pastries, and watch taking healthy sugars like honey, agave. Most fruits like bananas, mango, pineapple, grapes, apples, but you use small amounts of berries. Smart carb swaps like cauliflower rice, zucchini noodles, almond and coconut flour baking, lettuce wraps, 85% plus dark chocolate in small portions. Electrolytes matter like keto shifts fluid and sodium balance. Use broth, mineral water, or add electrolytes like sodium, potassium, magnesium to reduce keto flu. Now before we go into the real advantages of keto diet based on reports and research, you can simply support this channel by hitting the subscribe button, liking and leaving a comment. It's one for the best way to support. Weight loss and appetite control. Keto can reduce hunger for many, driving spontaneous calorie reduction. Short-term studies show weight, blood sugar, and triglyceride improvements, especially in insulin-resistant adults. But long-term superiority over other well-run diets is less clear. Quality and adherence matter more than the label. Blood sugar and diabetes management. Low-carb patterns that's not always strict keto are recognized by diabetes organizations as a valid option to improve glycemic control. Some patients reduce diabetes meds under medical supervision. Neurological uses. Keto remains a therapy for epilepsy and is being explored for mood and cognitive disorders with early but intriguing results in some videos and emerging research. Not medically advised but can be monitored only when you work closely with clinicians. Common early issues can result in keto flu, fatigue, headache, constipation, bad breath which is often related to fluids and electrolytes or rapid dietary change. These usually improve within days to weeks. Nutrient gaps. Strict keto can cut fiber, vitamin C, folate, and potassium if you skimp on vegetables, nuts, and seeds. A vegetable-forward, minimally processed keto reduces this risk. Cholesterol changes. Triglycerides often fall and HDL rises, but LDL-C, which stands for low-density lipoprotein cholesterol, and APOB can rise sometimes dramatically in a subset of lean athletic people. If LDL-C or ApoB jumps, reevaluate saturated fat sources, consider more unsaturated fats, or consider an alternative plan. Adherence and social fit. It can be hard to maintain and weight regain is common when people revert without a transition plan. Sustainability matters. Who should be cautious or avoid it? Pregnancy and breastfeeding mothers, people with history of eating disorders, certain kidney or liver conditions, type 1 diabetes or risk of ketoacidosis, and people on glucose-lowering meds without medical oversight. Always talk to a clinician first before starting. The good part, lower triglycerides, better glycemic control and weight loss can improve several cardiometabolic markers. Replacing refined carbs with unsaturated fats like olive oil, nuts, fish, aligns better with heart health guidance. The cautious part. Keto patterns are heavily saturated in fats and low in fiber-rich plants which can raise LDL-C or ApoB, and observational data links keto-like diets to higher rates of cardiovascular events. The American Heart Association ranks strict low-carbs keto patterns lower for heart health as commonly practiced, because people tend to cut fruit, legumes and whole grains and add more saturated fats. Data in chronic kidney disease is limited and mixed, but short to intermediate studies haven't shown uniform kidney decline, but clinicians urge caution in chronic kidney disease and to monitor labs and hydration. For people with fatty liver related to insulin resistance, low-carb approaches can reduce liver fat as weight and glucose improve. Avoid ultra-processed meats and excessive saturated fat to keep lipids and liver enzymes in check. Long-term clinical keto therapies in specialty settings haven't consistently shown harm to thyroid or bone when managed properly, but these cohorts are closely monitored. Some report clearer skin due to lower sugar and refined carbs. There is no strong evidence that keto causes cancer. That rumor usually comes from confusing high-processed meat or low-fiber dirty keto. On the flip side, research is exploring keto as an adjunct to cancer therapy, leveraging tumor glucose metabolism, also known as the Warburg effect. If somebody has cancer, do not self-prescribe keto. Speak to your oncology team, enroll in clinical nutrition support if considering it. Keep protein adequate, prioritize nutrient density, and avoid unintentional weight loss unless your team directs otherwise. Choose your fat pattern, favor olive oil, avocados, nuts, seeds, and fish, and limit butter, cream, processed meats. Set your carbs. Start at 20 to 30 gram net carbs per day for 2 to 4 weeks, mostly from non-starchy vegetables and small berries. Protein target, 1.2 to 1.6 gram per kilogram ideal body weight daily, and varies by age to preserve muscle. Electrolytes and fluids. Add sodium and potassium or magnesium sources. Aim for adequate hydration to reduce headaches, cramps, and constipation. Track and tweak. If you start feeling lousy beyond the adaptation phase, switch to a more moderate, plant-forward low-carb plan or a Mediterranean pattern. If you take glucose-lowering drugs, you must coordinate with your clinician to avoid hypoglycemia. Simply choose keto if you are insulin resistant or have type 2 diabetes, and your medical team supports a low-carb approach. Also, if you are motivated to eat a clean, plant-forward version with olive oil, fish, nuts, and tons of non-starchy veg, keto is for you. Or you can skip keto or try moderate low-carb Mediterranean plan. If you can't sustain the restrictions, you value legumes, fruit, and whole grains, or your LDL or ApoB shoots up. If you're going to try keto, do it smart. Start with the clean food list you saw today. Favor olive oil, avocados, nuts, seeds, and fish. Keep veggies high, protein adequate, and processed meats low. Hydrate, salt to taste, and use electrolytes. Recheck labs in 6 to 12 weeks and pivot if LDL-C or ApoB jumps. So like I said, these videos we create take time and research to finalize and conclude, but you can tell us in the comments if you going clean keto, moderate low carb, or Mediterranean. Subscribe if this was helpful. See you in the next one.